Но мы тут впервые, собственно, за долгие годы, чтобы поделиться успехом и переломом в противостоянии эпидемии ВИЧ.
Спасибо. Thank you. And I will give a floor to Michelle Kazackin, UN Secretary General, Special Envoy for HIV/AIDS in Eastern Europe and Central Asia.
Thank you. Good morning, everyone. I'd like to make a few points and first congratulate Andrei and the Ukraine Alliance for the work and for the remarkable results that are presented today. Basically, I'd like to make 3 points. My first point is that we should learn the lessons of the reasons of that success. And to me, there are a number of reasons. The first one is a strong advocacy background, the advocacy that the civil society in Ukraine has been conducting for several years, based on epidemiological evidence, based on human rights, based on sensitizing decision makers and the public opinion on the human impact of the disease and of the poor access that people in Ukraine had to HIV services. The second reason is the resources. And here I must acknowledge, and that's not too difficult for me, I must say, the strong involvement of the Global Fund to fight AIDS, tuberculosis, and malaria in having funded Ukraine and the Ukraine's fight against HIV since 2004. Ukraine's program started with the first grant ever of the Global Fund in what we call the first round. Third, the political commitment. I have seen ups and downs in Ukraine, but I believe there is an overall recognition by the government of the threats of the epidemic and of the need to act. And I personally have perceived that in my meetings with Prime Minister Azarov last year, and more recently with the current Minister of Health, Madame Bogatsirova. Fourth, and to me most importantly, this success is the result of a joint effort between the civil society and the government. NGOs such as the Alliance, such as the network of people living with HIVs, have been capable to achieve in Ukraine that they would that they would acquire the technical knowledge to implement programs and the management knowledge in managing large fundings from the outside, and work in harmony with the public sector in order to really achieve these goals in the fight against AIDS. A remarkable achievement and an example for the region. My second point is that if success has been achieved, it is not because of just large-scale implementation of harm reduction or just large-scale implementation of treatment. It is because of putting together prevention and treatment. And these days in AIDS, some of you may know, there is still a debate, and there's a big debate about treatment being also a way of preventing, but I would like to emphasize here that prevention and funding for prevention, which we do not see in many countries in the region, is absolutely essential in addition to treatment. And my last point is that as we celebrate this success, and again, congratulations to our colleagues, we should also realize that this is very fragile. It is fragile because we do not know what the future of the funding is, particularly if the funding from international sources is decreasing. Fragile because I do not quite know what the future of Ukrainian politics will be. Fragile because of the risk of spread of the epidemic beyond the vulnerable populations to the generalized to a generalized epidemic, as we now see in Russia. And fragile because AIDS is not the only harm here in the region when it comes to people who use drugs and the harm of inappropriate drug policies. We're also talking about TB. We're also talking about hepatitis C and the need for huge investments. Anyway, I think the example of Ukraine tells us what it is that we should do. We know what it is that we should do. If we do it, we can win the battle. Вот кратко, может быть, сказать несколько слов. Вот, я хотел сказать, что для меня главным образом несколько причин к успехам в Украине. Эти причины сперва очень сильная адвокация, которая не государственные организации, гражданское общество вела в стране. Во-вторых, финансы, большие финансы, главным образом из глобального фонда. Последние 10 лет, уже 10 лет, как эти программы финансируются. Третье, что политическая, в общем, обязанность и политическая воля, я говорил, что я чувствовал в моих контактах в Украине с правительством, что эта воля, хотя иногда высокая, а иногда низкая, но как-то она есть, и я ее чувствую. И главным образом, и это мой был четвертый пункт, что я думаю, самая важная причина этих успехов – это то, что гражданское общество и государство могли вместе работать в одной программе, того, что мы не видим в других странах этого региона. Потом я сказал, что успех этот не из-за профилактики или из-за лечения, но из-за того, что в Украине финансировалось вместе и профилактика, и лечение. И это очень важный урок для региона, потому что в многих странах региона, как вы знаете, финансируется лечение, но очень мало денег, если даже какие-нибудь деньги, и идут на профилактику. И последний мой пункт был, что эти успехи я, конечно, поздравляю как-то Украину с успехами, но я тоже как-то волнуюсь о том, что будет в будущих месяцах и годах, потому что многое мы не знаем о финансировании, многое мы не знаем о политической обстановке, и многое мы не знаем вообще о том, как можно будет строить на этих успехах, чтобы борьба шла не только по ВИЧ-СПИДу, но и по туберкулезу и по гепатиту.
Thank you very much.